4:45.
Kristen Seiler-Klein is returning from a police call to a man who family members believe was suicidal. She's not a police officer, but a licensed social worker who since 2019 has been helping St. Joseph Police help those who aren't criminals, but are definitely troubled.
The officers were able to de-escalate, and I was able to conduct a crisis screening.
Instead of sending the man to a hospital, something that most likely would have happened had police responded on their own, Kristen determined the young man was angry, not suicidal. She set up an appointment for him with a mental health counselor and even offered to drive him.
That's why it's so nice to be able to screen him in the moment.
Plus, instead of police having to write up a report on that call, she writes up the report, letting police focus on actual crimes. That's just one of the reasons Kristen is so well accepted by St. Joe Police.
You wouldn't believe how they support these programs. Our officers, they engage with these mental health liaisons every day.
Sergeant Jason Strong says having social workers on staff has changed how police respond to many calls, particularly domestic violence calls. More emphasis is now put on the victim.
Hey, do you need a place to stay? Do you need somebody to take care of your kids? Do you need clothes for an interview? What do you need?
4:45.
Police also appreciate that Kristen is often the go-to person on 911 frequent flyers, like the elderly woman who calls 911 nearly every day.
But this lady is very unwell. She has consistent delusions, thinks people are like taking her bones.
Kristen convinced her to seek mental health counseling and made sure she got to the first appointment. She still checks in with her on a regular basis. Other frequent callers are sometimes just lonely. Kristen puts them in touch with a mental health helpline called the Warm Ear Line. It's staffed by people trained and willing to just listen to people talk. Last year, Kristen and her counterpart, Liz Harrington, handled 800 cases. Almost everything they do is being tracked by the Missouri Department of Mental Health.
What we do is every person that we meet with, we are collecting data on them. So their name, date of birth, that basic information. But then we are also stating at the end what we did. So did we have to hospitalize them? Did we connect them to a resource? Did they refuse? Did they not need any resources?
For all they do, they don't cost the St. Joe Police Department a dime. Their salaries are paid by their employer, the Family Guidance Center, a nonprofit mental health agency. The other big benefit of that arrangement is that it encourages police to share their own personal struggles.
Like maybe problems with family, maybe marital issues.
Or even problems on the job. Police know that what they say will be kept confidential. Police tell us that after 2 years, even their biggest skeptics admit this kind-hearted social worker
41.
is making a difference, helping decipher between the struggling and the dangerous, and getting people the help they need. Linda Wager, Fox 4 Problem Solvers.